As the speakers before me have highlighted, there are many reasons why Maine should accept federal funds to increase health coverage for up to 69,500 of our friends and neighbors. It turns out that accepting these federal dollars will not only improve the health and well-being of tens of thousands of Mainers, it will also provide significant boost to Maine's economy. Our analysis shows that by 2016, Maine will receive approximately $250 million in new federal dollars each year. These funds will ripple through Maine's economy. They will pay hospitals, physicians, pharmacists, mental health providers, and other healthcare providers. These healthcare businesses will use these funds to purchase materials and equipment and to pay the salaries of doctors, nurses, health aides, administrative personnel, and others. And in turn, those individuals will use their wages to purchase food, clothing, and other goods and services in their community. That's what we set out to understand. What are the economic impacts of this chain of events? It turns out that they yield significant and measurable activity. Analysis conducted by Maine Equal Justice Partners and the Maine Center for Economic Policy indicate that accepting federal funds to increase health coverage will create more than 3,100 new jobs and stimulate over $350 million in annual economic activity by 2016. These dollars in this activity will also increase state revenues by close to $18 million a year. Of course, Maine people are frugal by nature. Even for the thriftiest of Mainers, the case for accepting federal funds is strong. Maine is one of 8 states that are expected to save money by accepting federal funds available through the Affordable Care Act. Because Congress has already set aside the money, if the governor and legislature do not accept federal funds, Maine taxpayers will help pay for health coverage in other states while foregoing the potential benefit of these dollars here in Maine. Think about that for a second. Go down to the general store and tell your friends that they're paying for the health care of folks in Massachusetts, California, perhaps Florida, Ohio, and we're not getting any of those benefits here. I think most Maine people, even the frugalist of them, will say, that's just not right. So accepting federal funds to increase health coverage makes dollars and cents for Maine. It is paid for largely with federal dollars. It creates jobs, boosts Maine's economy, and improves Maine's business climate and worker productivity. It protects large employers from costly fines and slows the growth of health insurance costs. It's a good deal for all of us. It delivers significant benefits to individuals and areas of the state that need it most. It turns out that a disproportionate share of the folks who will benefit, the individuals who will gain coverage, live in the most rural parts of our state. It is essential not only for those individuals who would finally have access to health care, but for Maine's continued economic development and ability to compete with other states.